Let's discuss about axillary artery. Axillary artery is the continuation of the subscapular artery. It continues as the brachial artery at the lower border of teres major muscle. The axillary artery is crossed over by a muscle, pectoralis minor. The crossing of the muscle, pectoralis minor, divides axillary artery into three parts. Each part gives certain branches. A small mnemonic that you can go with is that part 1 gives one branch, part 2 gives two branches, and part 3 gives three branches. Let's talk about the first part. The first part gives a branch called the superior thoracic artery. It runs along the superior border of the pectoralis minor muscle. This artery is going to supply the pectoral muscles and thoracic wall. The second part gives two branches. The first one is thoracoacromial artery. Thoracoacromial artery runs along the upper border of pectoralis minor muscle. It gives four branches. A little mnemonic that you can go with is that cadavers are dead people. C stands for clavicular, A stands for acromial, D stands for deltoid, and P stands for pectoral. Next one is the lateral thoracic artery. Lateral thoracic artery arises from the second part. It runs along the lower border of the pectoralis minor muscle. Lateral thoracic artery is longer in female and gives off lateral branches which supply the breast. The third part gives three branches. Let's talk about the subscapular artery. Subscapular artery is the largest branch of the axillary artery. It runs along the lower border of subscapularis muscle. It supplies the serratus anterior and latissimus dorsi muscles. It gives off a long branch called the circumflex scapular artery, which is going to pass through the upper triangular space. The next one is anterior circumflex humeral artery. It arises from the third part of the axillary artery. It runs lateral and anastomosis with posterior circumflex humeral artery. On the course, it is going to supply the head of the humerus and the shoulder joint. And the last branch is nothing but your posterior circumflex humeral artery, which is also arising from the third part of axillary artery. It passes through the quadrangular space, and its due course, it is going to supply the shoulder joint, the deltoid muscle, and the muscles that form the boundaries of the quadrangular space. Brachial artery. Brachial artery is the continuation of the axillary artery at the lower border of teres major muscle, and at the neck of the radius it divides into radial artery and the ulnar artery. Let us look at the relations of this particular artery. This artery runs downward and is lateral in the front of the arm. Anteriorly, we have median nerve, bicipital aponeurosis, and the medial cubital vein. Posterior relations include triceps brachii, radial nerve, profunda brachial artery. Medially, we have the ulnar nerve, basilic vein, lower part of the median nerve. Laterally, coracobrachialis muscle, biceps brachii, upper part of the median nerve, and tendon of biceps brachii. An important point to be noted is that the median nerve is crossing the brachial artery from lateral to medial side. Let us look at the branches of the brachial artery. At the lower border of the teres major, the axillary artery is continuing as the brachial artery. Just at the border of the teres major, it gives off a long branch called the profunda brachii branch. This is going to be accompanied by the radial nerve. Next is the nutrient artery. Nutrient artery is going to supply to the humerus bone. Superior ulnar collateral artery arises from the upper part of the arm and is accompanied by the ulnar nerve. Inferior ulnar collateral, this artery is arising at the lower border of the lower part of the arm and is going to involve in the elbow anastomosis. And at the neck of the radius, this brachial artery gives two main branches, the radial artery and the ulnar artery. Let us look at the biggest branch or the largest branch of the profunda brachii. It gives off three main branches. One is deltoid, supplies the deltoid muscle. And then radial collateral. Radial collateral is also called as the anterior descending artery or anterior descending branch, and middle collateral also called as the posterior descending branch. Clinical anatomy of brachial artery includes brachial pulsations, which is felt in the cubital fossa just medial to the tendon of biceps for checking blood pressure. It is also used in compression of brachial artery. Radial artery. The radial artery is a branch of the brachial artery at the cubital fossa. In the palm, it continues as deep palmar arch. Let us see the course of radial artery. It runs downward to the wrist. It turns posteriorly to enter into the anatomical snuff box. It continues as a deep palmar arch in the palm. The relations include anteriorly brachioradialis, posteriorly the tendon of biceps brachii, supinator and pronator quadratus, medially pronator teres and tendon of flexor carpi radialis, laterally brachioradialis and the radial nerve. Let us look at the branches of radial artery. At the neck of the radius, it gives radial recurrent, which involves in the anastomosis of elbow. Muscular branches which supply the lateral muscles of the forearm, dorsal palmar carpal, anterior carpal, and the superficial artery. Ulnar artery is a terminal branch of brachial artery. It divides in the palm into superficial and deep palmar branches. The course of the ulnar artery includes that it runs obliquely downwards and it is the largest terminal branch of brachial artery. Anteriorly, it is related to the flexor muscles, posteriorly brachialis muscle and flexor digitorum profundus, medially ulnar nerve and flexor carpi ulnaris, laterally flexor digitorum superficialis and median nerve. Let us look at the branches of the ulnar artery. Just at the division or at the neck of the ulnar bone, it gives anterior ulnar recurrent and posterior ulnar recurrent, which involve in the elbow anastomosis. It gives a large branch called the common interosseous, which further divides into anterior interosseous, which is the deepest branch of the forearm, and posterior interosseous. It also gives muscular branches, posterior carpal, deep and superficial branches. Let us now discuss superficial palmar arch and the deep palmar arches. Superficial palmar arch is the continuation of the superficial branch of ulnar artery, and it is completed by the superficial branch of radial artery. It gives three common proper digital and one proper digital branches. Relation: superficially, it is related to the palmar aponeurosis, and in the deep, lumbricals and long flexor tendons. Deep palmar arch is the continuation of the radial artery and is completed by the deep palmar branch of the ulnar artery. Its branches include three palmar metacarpals, recurrent branches, and three perforating branches. Relations: superficially, lumbricals and long flexor tendons, and deep interossei.